on doing a story about this, connection between dopamine, its imbalance,
Mhm.
and how it affects our mental states, and as well as how it uh, causes kind of addictive behaviors, also the imbalance. So, from a chemistry point of view, could you please explain first of all, like how this actually works, like this, how dopamine functions, and
Okay.
when something like I just wanted to know about this, pleasure pain balance also, because what's the kind of chemical reactions involved when we do something pleasure?
All right. So, to say it in layman terms, in a very simple version, dopamine is a feel good hormone. It's called as a feel good hormone, which is produced by the brain. And it is also a neurotransmitter, as in, it acts as a mediator between the nerve cells and your brain. So, it sends messages to the nerve cells from the brain. And to say about how it acts, or it is being synthesized by an amino acid called as tyrosine, and when it is being released is in your normal day-to-day activities. For example, when you're having food, you become happy, or when you accomplish a task, you become happy, uh, or any simple day-to-day activities can cause the release of dopamine in your brain, and that is a kind of a rewarding feeling, right? But when dopamine levels become abnormal in your brain or in any other biological fluids, that's when it becomes dangerous. So that could lead to diseases like neurological disorders. uh, the best example is Parkinson's disease, which is caused by low levels of dopamine in the brain.
Mhm.
Schizophrenia, which is caused by excessive levels of dopamine in the brain, and of course, addiction. So, addiction can lead to these kind of disorders.
Mhm.
Best example again is alcohol, or let's say any other drugs that we use, which, for example, when we have alcohol, it releases a kind of happiness in the brain. And that is because dopamine is released in the brain. So,
Mhm.
what happens is over time or overuse of these drugs, the the tolerance level of the brain actually becomes very high, right? So it
Mhm.
sets a high standards of tolerance when you have these kind of drugs, because it needs high levels of dopamines to be released in order to get that kind of a pleasure.
Mhm.
And that is when you get into an addictive kind of a stage. So it's very important to know the dopamine levels, not just the dopamine levels. So this is another thing. So there are different neurotransmitters like
Mhm.
dopamine, serotonin, there is adrenaline, noradrenaline. Each one has different functions. For example, serotonin is called as the happy hormone.
Mhm.
Adrenaline or noradrenaline are called as the fight or flight hormones. So each of them have their own task. So serotonin makes us happy. We generally say it makes us happy, or it is related to all the happiness related activities in the
Mhm.
brain. Uh, Dopamine is the what do you say? It's the rewarding or the motivation or the pleasure releasing hormone, whereas fight or flight hormones are the ones which triggers tensions or uh, immediate actions, or stress is all connected with the other kind of hormones. So what I have developed is a device to detect dopamine levels specifically from
Mhm.
all the other neurotransmitters or other compounds in the brain,
Mhm.
and this could be useful. So when we had previously, when we have had interviews with newspapers, uh, what they published was that, a new sensor has been developed where people can use it to measure your happiness, but
Yeah,
that's
yeah.
not the case actually.
Yes,
You
yes,
can't
exactly.
Normally people can't just buy this device. So after that, I got several calls asking me if we could get this device and if we can measure happiness, but that's not possible. A normal person cannot go buy from a clinic or from a shop this device and measure your happiness. That is
Mhm.
absolutely not this idea.
Mhm.
This can only be used by hospitals, by medical practitioners, in clinics, by authorized people, because this, for the measurement of this, you need either cerebrospinal fluid,
Mhm.
blood plasma, or it could also be detected in urine, saliva, and all, but that's all in extreme cases. And this is not for anybody to just measure, just like how we measure the glucose. So for glucose, we have a device called as glucometer,
Yeah.
which I think anybody can go and purchase back in India. Here, it is not possible in the UK. You can go purchase directly. You can measure your glucose levels. If you can take a drop of your
Right.
blood
Yeah.
sample, and then you can measure that. But you cannot measure happiness like this, because this is, if we start selling in that way, then people will start measuring your happiness, and they try to use other kind of drugs to increase your happiness, which is not
Yes.
advised.
Yes.
Would be used by, again, hospitals and doctors for diagnosing neurological disorders, for addiction diagnosis, and of course, like I said, if it could lead to some other psychological disorders, they could
Mm.
use that to monitor and for the treatment of such disorders.
Mm.
So this is the idea of this device, basically.
Yeah.
And like,
And
yeah,
can you just tell me about how it functions? Because it involves some kind of electrodes and all. I read about that. But
exactly.
can you just give an idea about it?
So this, to make it easy, I would say this is somewhat similar to the glucometer, wherein
Mm.
you have a small device kind of a thing. You insert disposable strips into it, and the strip is called as an electrode,
Mm.
wherein uh, I have I have developed a chemical component in the center of the strip, which will accelerate or catalyze uh, the oxidation of dopamine. So what we basically do is, in that strip we add certain amount of, or a very small amount of, when I say very small, I think being a chemist, I have to specify the exact amount. It's just about 100 microliters or 50 microliters, that very little amount of your biological sample you add to it. It could be anything. It could be your blood, it could be your urine, saliva, cerebral spinal fluid. You add that to it, and then what happens is, as a normal person, you just press it and then it starts working. But the chemistry behind is that you you apply certain kind of a potential,
Mm.
electrochemical potential to it, and that potential will oxidize dopamine.
Mm.
Dopamine is a chemical compound. It oxidizes dopamine. It converts it into another kind of a compound.
Mm.
During that conversion, it produces a current, and it's
Okay.
that current that we measure. And
That
that current,
circuit is, that
exactly.
circuit will
And
become.
exactly. And that current will be directly proportional to the concentration of dopamine which is there in it. For example, if your level of dopamine at this point, if I measure, is very low, just say if it's in
Mm.
the nanomolar level,
Mm.
so the current produced will be very low there
Mm. Mm. Mm.
when I apply, because that only so much of dopamine is present there. If
Mm.
mine is quite high, the current produced will be high. So the current is directly proportional to the dopamine concentration present in
Yeah.
the sample.
Mm.
With that, you can measure the dopamine
Mm.
concentration.
What is that chemical component that
So
that is
it's a
produced
chemical
after its
compound.
oxidation? After its oxidation, yeah.
Oh, okay. So, oh my God, that's a very tricky question. So it's a metabolite of dopamine. So
Okay.
basically, dopamine has got an OH structure and all that, and that OH changes. So it's a totally chemical structure. Maybe I can give you the structure of that, but then there's no specific
No, I
name
just
for it.
wanted to.
It's just,
Okay. Can we call it
yeah,
metabolite?
yeah, a metabolite, or you can say an oxidized dopamine form.
Form. Okay.
The dopamine, oxidized dopamine form. So it basically gets oxidized, just like, for example, rust.
Mm.
These metal, iron gets
Ions.
rusted.
Right.
Yeah, iron gets rusted because of oxidation.
Mm.
Similarly, the oxidized, so that's called as iron oxide.
Mm.
Similarly, an oxidized dopamine form.
Oh, okay. So, you said that there is, when we release this dopamine, a chemical pathway will be established, right? So,
Hmm.
when my understanding is that an addiction is formed when a chemical pathway becomes kind of a permanent kind of thing in the brain. So, is it possible to reverse this whole thing? Because you know, you said that it will be used your device will be used in a medical setting. So, in some way, whether the a psychiatrist or somebody like that can help the patients to reverse the thing and create a alternate neural pathway or something like that, to help people from these kind of addictions. Is it
So
a
this
possibility?
is yeah, so this is more of a question that should be answered by a doctor because I'm not a medical doctor. So
Yeah.
in terms of chemistry, what I can say is, if like you said, addiction, if somebody has to stop addiction, the only way for that is to stop using it, because once or you reduce the amount that you use it, because after a
Mm.
certain point or over time, when you keep using it, what happens is your brain is not able to identify the natural production of dopamine. The kind of dopamine levels that you are giving it is so high that it's unable, or the receptor, the dopamine receptor has become desensitized. It doesn't know what's the natural level. So what happens is you'll stop enjoying the day-to-day activities. Like I said, uh, uh, getting a promotion or eating food, that doesn't make you happy, because your brain does you have set a very high level of dopamine production in your brain, and you want that level in order to become happy.
Mm.
So the only thing you can't, you could maybe possibly, like you said, in the pathway, like I said, this is oxidation of dopamine. You could do a reduction of dopamine
Okay.
to reverse it probably, but that again, for that you'll need to use certain kind of medicines, and I think the best answer can be provided only by a doctor or a pharmaceutical company for that, if they have
Mm.
medicines to reverse this kind of a
Yeah.
pathway.
Yeah.
My contribution is that I can sense this at a very early stage, can detect the dopamine levels, which is not currently available in the market or to doctors. So I did speak to several doctors. I did conduct a survey with psychologists, psychiatrists, neurological patients, uh, GP patients, and I mean GP doctors, and they were all saying that currently they don't measure dopamine levels for any kind of uh, disease diagnosis or treatments.
Mm.
But they were saying if they get such a device, then of course, then they could start thinking about it.
Yes.
During
Yeah.
treatments or for monitoring, they could start using it, measure that, and then accordingly change the medicines, or like you said, try and reverse, use medicines which can try and reverse the dopamine levels for that. So currently, since there is nothing as of now, they don't use it. But if they
So
get
this
it,
is
they'll start.
first of its kind in the world.
Exactly. Yeah.
So there must be something that might
First of
have.
its kind in the world, when I say, there are several dopamine sensors which has been published as papers,
Oh,
but to my knowledge, as of now, I haven't seen any device that is being currently used anywhere for detection of dopamine levels.
so there must be something that actually triggered you to turn your you wanted to do something on this because there must be
Exactly.
something. So can you share what exactly what was the
So
reason?
one thing is, my PhD work was based on the development of chemical and biosensors, and I've developed several sensors for neurotransmitters, for other clinically important compounds like paracetamol, for pharmaceutical compounds. And when I completed my PhD, I realized that we are being producing thousands of sensors. The only thing what happens is that it either comes into your publication or it goes into your thesis. Nothing is being used for the common man. It's not getting into the market, or people are not being able to use it. So I thought it's high time that you take your research work to the public, so
Hmm.
that it becomes useful to the society. My father himself uses glucometer, and I've seen him use glucometer, and how effective that use is, to get the glucose levels. So I was
Yeah.
thinking, and I've seen several patients with Parkinson's disease, with schizophrenia, people who have addiction, who who would who would actually need this for their treatment and for monitoring purposes. So that's when I thought, there should be a meaning for our research. We need to take this to the next level. And that's when I joined for my postdoc in the same lab, I decided to when I decided to, of course, I was working already on the neurotransmitters, but then I decided to convert that to a device, and then probably um, I also started my own company at that time
Hmm.
for this sensor. It was called as Chem Sensor. It was a startup from Cochin University. And the first project for that was this Dopameter device development under the company. But unfortunately, I couldn't do anything further for that because I moved to the UK. But my team back there is working. So developing a device doesn't mean it's reached the market. So once the
Mhm.
device has been developed, the next step is to conduct clinical trials with
Yes.
patients and then get medical approvals because it's a medical device, and only then it goes into the market. So we've just reached a stage where we have developed a functional prototype for that,
You
and
haven't started the clinical trials, so.
that has not yet been started, but then it
But
has been
before
lab.
that, yeah, lab
Yeah, so
tested.
it has been lab and I would say field tested, because we have tested it in real dopamine samples, dopamine injection samples, and we have also tested it in synthetic blood plasma urine samples. So we've got quite a lot of data on these kind of samples. The next step is to get into real patient samples.
Okay. So, since you are actually, calculating the level of race in different scenarios, so I just wanted to ask you, like, we have different kind of drugs available now, like not just these, chemical components I'm talking about. We have digital drugs also.
Yeah.
So, can you just give a comparison of kind of dopamine released in different scenarios? How much it is, how what is the difference between a person who is drinking alcohol and someone who is spending time in Facebook? What's the difference between the kind of dopamine
Absolutely
release?
no difference, I would say, because again, so this is one question which my husband has always been interested to know, because uh, I'll say about both the drugs, okay, both digital drugs and the other drugs. So I'll start off with the other drugs like weed, cocaine, uh, alcohol. Mm. So let's take cocaine first. Cocaine stimulates very high amount of dopamine levels at once itself. So even in one use, the amount of dopamine levels that the brain releases so high. But if you take weed, but I
Mhm.
don't think in India that's not what is being given. They do add synthetics to it. The original weed, which we actually get abroad, is producing, compared to cocaine or something, it's producing very little amount of dopamine in it, releasing very little amount of dopamine in the brain, which is why cocaine is very addictive compared to weed. Weed is not actually addictive unless you take a very high concentration, and that usually never happens. You would have never heard of anybody dying of weed uh, addiction or weed overdose, but that's not the case with others. So different drugs produces different dopamine levels in your brain, and that causes addiction. So a person who takes cocaine, he needs extremely high amounts of dopamine level release in your brain to become happy. So even the small things in life he's unable to enjoy, and that leads to problems like suicide or depression and things like that. Whereas alcohol, or I would say, of course, again, LSD is another drug, but that again usually it's a very common drug in the US and other places. So that usually binds to the serotonin receptor. I think it attacks the serotonin receptors, the happy hormone. So uh, so different drugs releases dopamine levels at different concentrations, and based on that, your addiction could also change. So like I said, a person having cocaine addiction could be having a very high tolerance of dopamine level in the brain compared to a person having weed uh, usage or alcohol usage. So drugs vary in that case. Now when we come to digital drugs, that is also highly I would say highly dangerous. Why? Because nowadays we know the young generation, we would have used phones when we were in the 11th or 12th standard, right? My
Yes.
niece uses phone, or she plays FIFA when she's 3 or 4 years old. She uses the proper controls and she plays that.
Yes.
So before, when we used to get a toffee or a toy, we used to be so happy. I mean, the kind of natural dopamine production with just that toy could make us so happy. But for my niece now, only if I give a very high, a very big gift, she'll become happy. So her tolerance level of dopamine in the brain is so high at this age, which means it's very clear by the age of 18, she will need some external dopamine uh, uh, sources to
sources.
increase, yeah, to increase the dopamine levels. And that is why, so we usually say here that since I'm in the UK, I clearly know, I've traveled to many of these European countries. The young generation now, they don't want alcohol. Most of them are using synthetic drugs because that's the kind of pleasure or happiness they want. uh, in the olden days, if we look at our fathers and uncles and all, they would be more or less happy with alcohol because that's the level of dopamine that they've wanted. But nowadays, youngsters want such high levels of dopamine or such high levels of happiness that they are looking for external sources. So even at a small age, the young generation are so much attached to digital media, social media. If you take Instagram, you put a post on Instagram. If you don't see many likes, there are people who actually go into depression if you don't have the kind of likes or the kind of uh, appreciation from others. So they want extremely high levels of happiness because of the digital drugs, I would say. And that could lead to them using external sources or other synthetic drugs to get
So
that
these
level
are
of dopamine.
connected. That's what you're
They're all
saying.
definitely connected. But I
Hmm.
would say there are pros and cons. We can't, you see, I won't tell my niece to stop using digital media because they want it. The world is very competitive. But the cons of that is that gradually they'll stop loving the normal things that we used to love, and they'll need external sources to get that high level of dopamine.
Yeah. This is one thing I just wanted to ask also, because children using digital devices at a very young age and getting addicted to it, and parents also put device in front of them, so that they will happily have the food like that. But what are the kind of see, you spoke about Parkinson's and other diseases that uh, result because of dopamine issues. But what are the kind of issues children can face because of these kinds of dopamine going high at a very young age? Is there something that
I currently haven't had any studies on children below 15 years. Above 15 years, there are chances of all these. Like I said, mood swings, depression, hallucinations. This is all connected. So any kind of mental or neurological disorders have been studied above uh, children above the age of 15. But below the age of 15, there are diseases, of course, related to dopamine, but that I don't think it's because of as of now, I don't think there are many studies because of addiction or digital drugs which is seen in young
so
kids.
in the normal scenarios, is the kind of dopamine release in children the same as a kind of
No,
dopamine release? No, it's also different.
no. That all varies depending on the age, depending on mm, yeah, the age definitely is a factor. At separate ages, you have different levels of dopamine release happening.
So that
So
is
that
that balance is also being affected, right?
parents are being affected.
No, no, no. That
In
balance also being affected.
that balance is also being affected. Yes, yes, that balance is also being
That
affected,
is
of
also
course.
shifting towards.
Exactly. Yeah. Like I said, that tolerance level is completely changing from that very early age.
Hmm.
So, as over time, just like alcohol or any other drugs, over time they are desensitizing their hormone levels. Their receptors are being desensitized, or their tolerance level of happiness is being set at a very high bar, which is why uh, over time we say that they become addicted to digital drugs.
Yeah. So now about your device, how you are planning to bring this out? What's the plan? When are you
Yeah, so
planning?
that's a good question. So currently, it has been patent granted. It's not just patent published, patent granted. The
Hmm.
owners are Cochin University of Science and Technology, with us being the inventors. Myself, my professor, Dr. K. Girish Kumar, and my collaborators, which is ProChip Technologies, which is also a startup in Kozhikode. So our current options are, one is to license this patent to any medical companies or pharmaceutical companies who want to take this forward and conduct clinical trials on that. And like I said, or the next step, so we're looking at all these options. The next step is to sell the patent to a higher company so that they can, from them, they can take it on from there. Or the next option is the next option that I had in mind was to license the patent here in the UK. So now the patent is an Indian patent. I need to convert it into an international patent, license it, and I'll be collaborating with MTIF. So it's the NHS and the MTIF in the UK. So NHS is the medical field here in the UK, the government agency here in the UK. So collaborate with them to conduct clinical trials, and upon completion of clinical trials, again move on to getting the medical device regulatory approvals, and then the next stage is commercialization. So we are looking at all these different opportunities, either licensing by somebody else or myself licensing it here in the UK and conducting clinical trials, or selling the patent directly and just getting the price of that.